Hi, this is Jay Varma, and welcome to Thermometer. On this show, I check the temperature of public health in the US and around the world, and I give you expert insights on infectious diseases and public health. There have only been 3 times in my 25-year career as a public health doctor that have truly feared for what might happen to our country because of infectious diseases. The first was in 2003. A new pneumonia started spreading throughout southern China and Vietnam and other countries in Southeast Asia. I was in the second year of CDC's elite training program called the Epidemic Intelligence Service. It's a program that trains doctors, nurses, and other types of professionals to become disease detectives, like you may have seen in movies like Outbreak or Contagion. That pneumonia in 2003 was SARS. But the world got lucky because there was a quirk about this virus. SARS only spread when people were at their sickest. So that actually made it easier to contain. If somebody just got infected and they only had a few symptoms, they weren't very likely to spread the infection to other people. The people that were most likely to be infectious were really sick, so you could identify them and isolate them and stop them from spreading the disease to other people easily. The world acted aggressively, and we stopped that virus. The second time I got that fear was at the end of 2019. I was working at the highest levels of public health in Africa when the first reports about another new pneumonia emerged from China. I know that region around Wuhan quite well. I had spent 3 years there helping the US CDC track new infectious disease threats in central China. But this time we weren't lucky. COVID-19 was different than SARS because it could be spread by people before they had any symptoms at all. People could walk around and spread the infection to lots of people without anyone knowing it until they got sick a week later. Within 2 years, over 1 million Americans were dead. And still today, just walk into any intensive care unit in America and you'll see people struggling to breathe or recovering from heart attacks or strokes because of a COVID infection. It continues to kill and disable Americans every day. And now, for the third time in my career, I feel that fear again. But this time, it's not because of a new virus. It's because of what's happening to the very system we rely on to fight diseases, public health. Let me be clear. The Trump administration has appointed Robert F. Kennedy Jr. to oversee all U.S. government health programs. And that's the same RFK Jr. who spent years spreading disinformation about vaccines and undermining the institutions that protect us from disease. Even today, with a measles outbreak in Texas, you're hearing that the vaccine might not be safe or that kids just need to eat healthy and they won't get sick. And none of that is true. The virus doesn't care if you're eating the right foods. It'll infect you if you aren't vaccinated. And this administration is cutting the very programs at CDC that are here in the US, programs by CDC and USAID overseas, the very programs that help us detect diseases before they become threats in the US. And if they do happen to become threats in the US, those programs, those agencies, they help stop them from making Americans sick. Most Americans don't realize that the federal government keeps the entire public health system in the US propped up. Your state and local health departments, they rely almost entirely on federal funding for a lot of their disease control programs. When I was in charge of infectious diseases in New York City, more than 80% of our disease control programs, HIV prevention, opioid overdose, vaccinations, outbreak response, all of those got huge amounts of funding by the federal government. You take that money away, or even just cut it in half, and those programs die. Slowly at first, and then quickly. Well, and then people die. Slowly at first, and then quickly. And if you want to know what happens when public health funding collapses and misinformation spreads, pretty recent history can tell us. All we have to do is look at what happened after the Soviet Union fell in the 1990s. The USSR had a centralized public health system that, for all of its faults, actually ensured that vaccines, drugs for diseases like TB, and medical supplies were distributed evenly across all of its vast territory. And after its collapse, there was no one to pay for these programs. So what happened in the USSR? After a few years without any public health funding, infectious diseases like measles, tuberculosis, and diphtheria came roaring back. Life expectancy plummeted by nearly a decade in some regions. That means in some parts of the former Soviet Union, people were living 10 years less than they were before. So that's not just history. That's our future if we dismantle our public health systems. So let's talk about the diseases that will surge first if we dismantle public health. Measles. This isn't just a childhood illness. It's one of the most contagious viruses that we know of. If an infected person walks into a room of 100 unvaccinated people, 90 of them will get sick. And it doesn't just cause a rash and fever. Measles suppresses the immune system for months, sometimes even for years, leaving people vulnerable to other deadly infections. And right now, what have we seen already? We're already seeing a growing measles outbreak because people have been refusing vaccinations. We've already seen 2 deaths, one in a child and one in an adult. And make no mistake, these are all preventable. And it's not with good food and exercise. Of course, those are important. We all know that. Every doctor, parent, or friend will tell you should eat well and exercise and sleep right. But your immune system also needs help to avoid getting sick from a virus as dangerous as measles. And that's what the measles vaccine does. Scientists have taken off the dangerous parts of the virus, and they give you just the right amount to harness the power of your natural immune system to help fight off a dangerous virus. In 2019, we saw major outbreaks in New York, Washington, and California that were fueled by small groups of people that refused vaccines. But public health teams stopped them. But what happens when there aren't enough staff or resources to respond? History tells us exactly what will happen. Measles will spread, children will die. Now, let's talk about the second disease that is likely to resurge. This is tuberculosis, or TB. TB doesn't spread as easily as measles, but it's deadly in a different way. If we don't track and treat cases properly, TB mutates into drug-resistant forms that are really difficult to treat. And that's exactly what happened in the former Soviet Union when public health collapsed. Multi-drug resistant TB spread everywhere. And decades later, Russia and Ukraine are still battling those infections. Here in the US, TB cases were an all-time low before COVID-19. But now, cases are rising again. In Kansas, we've already seen big outbreaks. And thanks to post-COVID laws that stripped public health agencies of their ability to enforce isolation, the US could soon become a breeding ground for drug-resistant TB. Now, let's talk about a disease that you've probably never heard of, diphtheria. And the reason you haven't heard of it is because we've had a highly effective vaccine for decades. So diphtheria is a bacteria that's found commonly in the environment that can find its ways into people's throats. And once it's there, it can produce a toxin that causes so much inflammation in your throat that people quite literally suffocate to death. The toxin from that bacteria can also damage the heart and other vital organs as well. And that doesn't happen anymore because the vaccine is so effective at blocking the effects of that toxin. But when vaccination rates drop, diphtheria doesn't just come back, it kills. After the Soviet Union fell, more than 150,000 people got diphtheria, and thousands of people died. So guess what? The US is starting to have the same conditions now as what you saw back in the USSR. Falling vaccination rates, a weakened public health infrastructure, and a government that isn't funding disease control like it should. If history is any guide, we may see diphtheria outbreaks within a few years, just like you saw in the Soviet Union or the former Soviet Union in the 1990s. The past has always been our best guide to the future. And there's another lesson from the past that's really relevant today. And this is one of my favorite sayings that I learned when I started working in public health. And that is, public health is purchasable. What does that mean? It means that we as a society can keep each other healthy. If we as a society want people to live longer, we can require that government invest in the things that help people live longer. If you want people to not just live longer, but also live healthier, you also have to invest in it. That means clean water, food, air, getting everyone vaccinated, or if they're sick, tested and treated as early as possible. Road safety, investing in mothers and babies, promoting active lifestyles. There's a long list of all the things we know that can keep people healthy and alive, but it's not as expensive as you might fear. And right now, it looks like the US is choosing not to pay. The result won't be measured in government savings. It'll be measured in lives lost. So what are some things that you can do? First, recognize that infectious diseases don't care about politics. They don't care what you believe. They spread based on science, not on opinion. Second, if you can vote, do it. Demand that your state and local officials protect public health funding. Vote for leaders who believe in science and protect public health funding. Vote against people who don't. And third, if you're a parent, make sure your children are vaccinated. If you're an adult, check your vaccination records. Public health systems may be weakening, but individual choices still matter. Because once those diseases return, the price of fixing the damage will be far higher than the cost of preventing it in the first place. The choice we make today determines what happens in the next decade. Will we protect our future, or will we let history repeat itself? It's really up to us. So if you're interested in these topics, you want to learn more, you want to get more involved, continue to follow me. Hit the like button, subscribe, and we'll keep you updated as much as we can about everything that's going on in the world and in the US as it relates to public health and infectious diseases.